Hey there, this is Dr. John from the Florida Center for Hormones and Wellness. And what I want to talk about today is a very common problem that I see when I institute therapy with biologically identical hormones. And the issue is that of immediate weight gain in the early initiation period. We see this both in men and women, and while it can be very disconcerting, particularly to the women, is that they can gain a little bit of weight, sometimes in the neighborhood of 3 to 5 pounds. In the cases of men, maybe a little bit. And I want to assure all of you that properly done biologically identical hormone therapy does not cause weight gain. That every study done to date that looks at hormone therapy over time shows a decrease in visceral fat and an increase in lean body mass and an overall net reduction in weight in people that are trying to either maintain or lose weight. And that's a very, very good thing. But notice what I said, that's in the long run. What happens in the short run sometimes is when you institute hormonal therapy in people that have been deprived of hormones for a period of time, and that can be either just a couple of months, but in many cases, a few years before they institute their therapy, is that some of the hormones that we use, either the estradiol, the progesterone, and particularly the testosterone, mimic another hormone in the body called aldosterone. And when the body sees those hormones, it gets confused for a little bit of time, and it causes the body to hang on to water. And of course, any woman is going to know that when you get water weight, you're going to feel bloated, you're going to feel heavy, you're going to feel a little bit uncomfortable. And in about 10 to 20% of women, we can see that. And I'll get a phone call sometimes 4 to 6 to 8 weeks after institution of therapy, and they're concerned about the weight gain, and it is often accompanied by a mention of those symptoms. Well, the reality is that weight gain in the immediate post-institution period is almost always water weight, as long as the woman or the man has done nothing else to change the way that they're eating or their exercise habits or their food habits. And that water weight is what is causing the problem early on. It's very simple to deal with, and a couple of things will happen. Either just wait it out, and over time the body will recognize the hormonal differences. It will readjust its water metabolism and get rid of that excess water. The other things that we can do are some very simple, natural things to do. Either drink more water. That's right, drink more, because now you force the body to recognize the water overload, and it will readjust more quickly. Watch your salt intake, or take some apple cider vinegar. Now, those 3 natural methods can be very effective at reducing the water weight that comes on from the institution of hormonal therapy. In the more severe cases, or in the cases that either the men or the women just don't like that water weight, you can use a mild diuretic or water pill to draw that extra water off, and that usually resolves the problem. So again, I want to assure everybody that hormones, when they're done right, when they're biologically identical hormones, they do not cause weight gain as long as you do not alter your eating or your exercise habits. So that being said and understood and truly recognized in the medical literature, if there's a short-term gain in weight, it's almost always due to water, and it can be dealt with effectively. And then recognize that in the long term, that hormone therapy is crucial for restabilizing and recalibrating your physiology, so that when you do the things that are necessary, you can actually effectively lose weight and get down to a body habitus and a body look that you're actually looking for, one that's healthier, one that's more vital, one that's more vigorous, and one that's more ready to take on the future. So this is Dr. John from the Florida Center for Hormones and Wellness, a little bit on water gain after the institution of hormone therapy.